Hello, I'm Dr. Richard Becker. It's my pleasure to welcome you to the University of Cincinnati College of Medicine's Scholarvision. Today we'll be discussing an emerging topic of importance, that is cardiovascular oncology. I'm joined today by Dr. John Lynn Jeffries from Cincinnati Children's Hospital Medical Center and its Heart Institute. Dr. Jeffries, welcome to Scholarvision.
Thank you for having me.
It's a pleasure to have you. And this truly is an emerging field of cardiovascular oncology, and perhaps you can tell our viewers just a little bit about what it is.
Sure. So cardio-oncology really, in my mind, is a multidisciplinary approach to the cardiovascular disease that is secondary to those patients that have cancer and receive therapy. Obviously, a very important topic, both independently important, cancer and cardiovascular disease. And we're having great successes at treating cancer both in childhood and adults. However, many patients do not recognize that their long-term prognosis is very carefully married to their cardiovascular outcome.
Yes. And I know in the adult world, it's been predicted that there are approximately an additional 1.5 million cancer survivors.
Correct.
Which is a wonderful statistic.
It is.
But as it turns out, some of our therapies, while very good and directed at cancers, do have some effects on the heart and the cardiovascular system. Can you comment just a little bit on what some of those might be?
Yeah, most all therapies have potential cardiovascular implications. Some are directly cardiotoxic, such as anthracycline therapies. Mm-hmm. Other therapies, and those are traditionally the ones that are most commonly mentioned when we talk about cardiotoxicity. But there are many evolving therapies, such as in the breast cancer world and others, where there are direct cardiac effects. There may be secondary effects, such as volume shifts, systemic hypertension. And then it shouldn't be forgotten that many therapies include radiotherapy, which obviously can affect the valves, the myocardium, the vasculature such as the aorta, and obviously can enhance the opportunities or accelerate the opportunities for coronary artery disease.
Yes. And in adults, we kind of look at things as kind of length of exposure. So if our patients are in their 60s, 70s, or 80s, their exposure to these potential toxic effects is relatively brief, but in pediatrics, there's a very, very
Correct.
long exposure.
And I think it should be remembered there are data out there, very compelling data, that effects on the myocardium and on the vasculature can be seen within hours of delivering chemotherapy. However, your body seems to accommodate these reasonably well. So you may see subacute effects, you may see chronic effects. And it's been our experience that it sometimes may be a decade or decades before evidence of myocardial involvement may present.
Yeah.
So one may argue that surveillance is potentially a lifelong issue, especially with those children and adolescents that have been treated for cancer and are effectively treated. It should be mentioned that the cure rates are quite high in pediatric cancers, and patients and families should recognize that they may do very well from a cancer therapeutics perspective, but they need to be cognizant of the potential risk of heart failure, cardiomyopathy, vasculature, coronary disease, valvular disease. All of these things may be part of their future.